So again, my name is Jeanne Milstein. I'm the Director of Human Services for the City of New London, Connecticut. And New London, Connecticut is actually the fourth most distressed municipality in the state of Connecticut. And 40% of our police responses are for issues related to mental health. And so Jerry is with us. Jerry, Clayton is the co-chair. Jerry, would you like to introduce yourself?
Yeah, were you done?
Everybody knows Jerry already, but.
Yeah, just really quick, Jerry Clayton, I serve as the Sheriff of Washtenaw County in my fourth term, full service Sheriff's Office. Happy to be here. As interested in sharing my thoughts, well, actually more interested in learning from many of you as I am sharing my thoughts. So I will mute Jeanne, please keep going.
Okay, thank you so much. I'll just very briefly about what we're doing here in New London. So 40% of calls related to mental health. We do have 30% of our officers are trained in crisis intervention, and we have available to us emergency mobile professionals who come out. But this is all crisis driven, and it's not working because we see a lot of the same people over and over again. So here in New London, in 2016, we initiated an opioid Navigator project, whereby we have individuals with lived experience who are our navigators and do outreach in the community to those who are struggling with substance use disorder. The model is based on harm reduction, engaging people where they are, listening to the people that we serve, and meeting where they are. This initiative has resulted in great changes because the navigators follow up. They are able to develop consistent, caring relationships with those they serve, and again, meet people where they are. And so we are taking this model and we are replicating it as a public safety mental health initiative. So we will have people with lived experience with mental health and interaction with police be our navigators. There, at some point, we hope that they will be able to respond, but we have to start, slowly. And so there will be warm handoffs between the police and the mental health navigators, and then the navigators will provide support services. Our navigators drive people to job interviews, take kids to childcare, drop off medicine during the pandemic, dropping off PPE and other necessary items. So that's what we're doing here in New London. I'm really excited, as Jerry said, to learn today and to listen. So, we're interested in hearing your feedback on the session. And then, Jerry, you want to go through what our goals are for today?
Sure. Our goals today is really first to give you an overview and an idea of what the governance work group is focused on, what our objectives are. And then there are, we want some participant engagement. So there are 2 questions that will be posed to you in a live poll that I think you may already have access to. And as you answer and respond to those questions, really will give us an idea of where we need to just take our discussion. We have a short period of time, and we're really just trying to get a feel for where people are, not only in this whole concept of transforming 911, but more specifically in the area of governance. So, Jeanne, I don't think you didn't cover the overview of our topics and our objectives, did you?
I did not. So I've talked enough, Jerry.
So here are the objectives for the work group. So the first one is really for us to review the governance structures and the processes, the different laws, both at a state and local level, to get ideas of agency operating protocols and orders and documents, how do dispatch centers, 911 centers ensure property quality control? What is the mechanisms for oversight? What's the process for implementation of standardized procedures? What is the organizational construct and architecture that really governs and guides 911 operations? the decision-making structures. And we saw this in the chat a lot. It's like police departments. There's one, we're not like the UK where there's one national police department. The same thing in this country. There's not one national way of doing telecommunication services, dispatch services. So what are those different constructs? Which ones are working? What are the best practices? And what do we need to think about in terms of influencing the governing bodies to move us in the right direction in terms of this transformation of 911 in a way that really provides the kind of equity and service that we're all striving for, that already exists in many spaces because of the professionalism of our 911 staff, but don't exist in all spaces. How do we get there? The last thing I'll say is, we'll look at those different models. As I said, the strengths and the weaknesses, the benefits, and quite frankly, try to engage as many of you as possible to share that feedback. So as recommendations are forwarded, they're informed recommendations, not only from the people that are receiving the services, but the people that are delivering the services and are responsible for the governance of those services.
Thank you. And so to Jerry's point, we have 2 questions. We'll have about 3 to 4 minutes for a response, and type your responses in, and they're going to show up on the screen as a word cloud. And so let's get started. The first question is, what words come to mind when you think of 911 today?
Sorry, Jeannie, I'm having trouble getting the permissions to share my screen, so I'm afraid I'm not going to be able to do the word cloud. So let's invite everyone to enter the answer to that question in the chat for now, and hopefully we can get my permissions up and running to share the screen for the next question.
Thank you, Matthew. So go ahead and
No
everything.
so, yeah, I'll repeat the question. It's what words come to mind when you think of 911 today? If you could just share in the chat, please. So we're seeing a lot of themes of first response, a lot of themes of safety, the sort of concepts of assistance, right? We're also seeing some sort of unsung hero themes here, underappreciated and important.
A lot around emergency, first response. Seeing them in two spaces, like the response, and then the cultural implications, like stuff around bias, both inside the organization and outside, unappreciated, reliable. So again, a lot of positives. I see one that says overuse, inappropriate use for mental health. Analysts. So a lot of the same words that you see as we look at all the different components of the emergency response system, right? First responder system.
Right. Staff shortages too.
Yes. Misunderstood, fractured.
Misunderstood.
We see a lot of that, and I think all that is accurate, which is why I think initiatives like this matter. Somebody put in the chat around I think APCO and NINA already having standards. That's exactly right. So we know that, and obviously you'd have to lean on that. So the standards are there. A lot of them are universal. How do the different organizations across the country? How does that work with them? How does it align? Are they using them appropriately? And again, you can have standards and policies and practices because we see it in a lot of professions. Does it still get us the outcomes that we want? And I'll say again, a lot of that is cultural. And you have to pay attention to culture in your organizations. And some of what I see sort of speaks to cultural implications.
And to your point, Jerry, too, it's, there's standards, policies, and procedures, but how they're implemented is really the key to everything. Yep. So people need to be well-trained, well-supported, and there needs to be a robust quality improvement mechanism in place because, you can learn a lot on paper, but if you're not implementing it correctly, it can compromise all of the work. And I think somebody pointed out in the earlier chat during the plenary session about that 911 can't just work in a vacuum. And that's why I'm so grateful to University of Chicago for convening this group, because the system depends on the first responders and the infrastructure of services in the community as well. And now you're making me think about, I want to go talk to some people who have been called, and I want to talk to them. And that's why we're excited about our navigators too.
Yeah, I think the other interesting thing to think about here too is, and I've seen this in this whole world and the narrative over the last 18 months around reimagining police, and this initial defensiveness that comes with some of this, because there's this belief that if you want to transform or reimagine, then you think we've done everything wrong. And I think, especially as it relates to 911, it's the opposite. That the 911 is so critical to provide and has provided such value. But any organization or profession wants to evolve and improve. And you do that with the input of a broad spectrum of people. So I would never discount the professionalism and the knowledge of our 911 professionals. We also want to bring in other folks and continue to challenge our paradigms and our basic assumptions about how we get better. So at least from my perspective, I think from all of our perspective, that's really what we're trying to do. So we invite our 911 professionals to be a part of this. And we're not assuming that you haven't done some of this work. We just want to incorporate a lot of the work.
Right. And Melissa raises a great point in the chat that the outcomes don't necessarily do with 911. It's the emergency responders' responsibility. The information is only, as good as what the caller provides. And going back again to the point where this is why the whole community has to, come together. We really need more of an infrastructure of services and supports in place. And that's just not just, emergency services, but the issues of systemic racism and housing and jobs. There's so many deeper issues.
Mm-hmm. And just one more, I think, comment to the comment is not putting all the responsibilities on 911, on the call takers and the dispatchers. Oftentimes, these are societal issues, and just like the police, 911 are the tool that's used by other folks that sometimes don't have the outcomes that we want. So it's not to put the burden on the dispatcher or the call taker or the 911 system. Is to understand the impact of societal culture on the system and how do we align all those things. So if things go sideways, we've seen this, it's not always the police fault. It's not always the dispatcher's fault or the call taker's fault. Are there some societal issues that we also have to address? And then how do we align and marry all those things up?
This is great, and this will give us an opportunity once we look at our notes to summarize and figure out some next steps, because I just want to be mindful of the time, because I think we only have until 1:25. So Jerry, you think we should move on to the second question?
Yes.
Okay, and we'll do this again in the chat. Okay, Matthew? Yeah, okay. And we have about 10 minutes, 10 to 12 minutes on this question. When you think about call handling operations, what are the most important aspects to focus on? Oh, we have until 1.
Governance. Yeah, we are this particular focus group. This room is focusing on governance. So when you think of governance, what are the most important aspects to focus on as we move the work forward?
I'm so sorry, I was reading from.
No worries. We have so many note pages.
So 911 governance, streamlining dispatch, data collection. I love the recognizing 911 is equal and separate from police and fire, because there is that tendency to lump them all together. Outcomes and accountability. So Elena touches on one that I think is really important to this work. What are the goals when the policies and laws were put in place, and what may need reexamination related to that? I think you're 100% right. When we think about the history of 911, like we think about the history of a lot of different components of this overall system, it is really important to understand the history and the original intent, because that has influenced policy and procedure and operational protocol, even if the people today don't recognize it. So we owe it to ourselves to examine that. And as we think about how we evolve, to make sure that we're not going off of basic assumptions that existed in the 60s and the 70s. And even if folks don't want to admit it, those basic assumptions sometimes had harmful effects on people. So we have to re-examine that, understand the history, and as we continue to evolve, make sure we have practices and protocols that don't continue to perpetuate those harms. So we can do really, really good and serve and cause harm at the same time. So as we move forward and we think about how governance, how do we make sure we have the right things in place that don't cause harm and continue to deliver quality service?
Right. And I think, and a lot of what's in the chat is too, like we have to step back, as Jerry said, and so many in the chat, and take a real independent look, a real independent review of who's doing what. To Katja's earlier point, let's see what's working and then break it down. One of the speakers indicated that the 911 system started under Lyndon Johnson. So, Jerry just mentioned, let's look at history. Let's see what's evolved here. And, this independent oversight, and then incorporating an equity office. I think that's really important.
So Yvonne talks about first aspect is to understand, the governance structure. What is the best way to visualize governance structures across the country? Where can we find similarities in governance? Where are there differences? The different structures, and in examining those similarities and differences, also looking at the outcomes as a result. So, as we try to see what is the best approach, the best practices, looking at the different models and then the outcomes, and also understanding that this service is a local-based service with different conditions and requirements that also have to be factored in.
And since we are focused on governance, one of the issues that has come up in the chat is the issue of liability. And I think that's really important and something we have to explore, because when liability becomes an issue, having worked in the child welfare world, when people get afraid, there sometimes can be just overreaction. So I think that's something that we have to look at. But I think there's a lot of great information here. Yeah, that I'm looking at the formal handoff. That's what we do with our Opioid Navigator program, and that's what this is we're like running out of time. We have 1 minute left, but I think our committee is going to be making a lot of recommendations that are really important around the governance and the policies and procedures going forward. So if I don't know if there's a way for people to sign up to continue with this group, Matthew, that would be really helpful, because we have so much to learn from the folks who are providing the services now. Okay, there's a sign up at Transform 911. So we hope that you will sign up for continued work in this particular area. So at the end of this, we can come up with some recommendations around governance.